Hello, my name is Kaye Moreno, and I'm put together this presentation for the local HIMSS chapter to compete for a chance to present at the upcoming regional conference. And the two topics I chose were HEDIS and ORYX, the quality and performance measurements. I struggled on choosing how to arrange this, whether I'd go in order of the three requirements and toggle back and forth between the two measures, or I do it one at a time. I feel the latter will make the most lasting impression and not confuse the two. Okay, HEDIS. A Pennsylvania hospital was collecting patient outcomes data in diagnostic groups as early as 1754. The earliest significant American efforts are generally attributed to Ernest Codman, a surgeon at Massachusetts General in the early 1900s. He was an advocate for a systematic healthcare performance assessment. A hospital would track every patient it treated long enough to determine whether the treatment was effective. It was the beginning of evidence-based care. The HMO Act from 1973, where grants and loans were provided and were available for the planning and startup phases of new HMOs, as well as for service area expansions of existing HMOs. State laws that restricted the development of HMOs were overridden for those that became federally qualified. Dual choice provisions required that employers with 25 or more employees who offered indemnity coverage must also offer two federally qualified HMO plans if they requested to be offered. The HEDIS purpose and functions. The NCQA is a non-profit organization dedicated to providing information that enables purchasers and consumers of managed healthcare systems, that is, systems of care for defined populations, to distinguish among plans based on quality. In order to remain In order to remain viable, plans needed to continue to deliver not only cost savings and a competitive benefit package, but they also must distinguish themselves in another key arena, and that is quality. And the associated oversight activity is performance measurement. They were basically indistinguishable from each other. The only way to set themselves apart were through quality in the field of quality. They began their accreditation program in 1991 with the MCOs and have since expanded to behavioral healthcare organizations, credential verification organizations, physician organizations, and most recently, PPOs. Consumers, researchers, policymakers, and purchasers, both public and private, of healthcare services are justifiably questioning the value or quality of healthcare at the price they receive. Of the healthcare they receive, and matching with to be in line with the price that they're paying. They want to see something for their value. Seeking quality at an affordable and reasonable price, and requiring that health plans, providers, and medical institutions all provide greater accountability for the quality of their services. I'm not going to read you all 90 of the quality measures, even though you're a captive audience. and it's remote, so you can't throw tomatoes at me. We'd be here all day, and nobody wants that. I'll just give you the highlights of the new ones for 2013. They've got the oral evaluation and dental services for children that are under 21 years of age. And their intent is for good oral health. It's a vital component of the child's overall health. And in line with that is the topical fluoride for children, Medicaid members 1 through 4 who received at least 2 fluoride varnish applications. And the intent is dental caries is the most common chronic disease in children, and the fluoride plays an important role in preventing tooth decay. And we won't even go into that about how they say that, yeah, it's also the side effects and enslaving our children. I don't know. Anyway, fluoride. Yeah. Okay. So desubscribing benzodiazepines for older adults. Medicare members 67 years of age or older who were dispensed benzodiazepines who achieved a less than 20%, no, greater than 20% decrease reduction in the benzodiazepine dose. It sounds like they're weaning them off. The intent is the 2019 American Geriatric Society criteria recommended that they be avoided in older adults, probably because of the cognitive effects that happens with it. I don't know, then they think that they had Alzheimer's, but it was just the medication. Thanks, Big Pharma. Rather than stopping use immediately to minimize withdrawal syndrome and improve patients' outcomes, this prescribing measure was, to reduce it 20%. There's an opportunity to promote harm reduction as assessing progress in appropriately reducing benzodiazepine use in adult populations. Emergency department visits for hypoglycemia in older adults. And apparently older adults are more at risk with developing hypoglycemia, especially if they're on the Basaglar. That's the longer lasting one. And social needs screenings and interventions. This is a subject that really is close to my heart. I believe that the social determinants of health are so important. And to those codes that they use, they're like flags in the system that show the healthcare plans that these are the people who need help. Okay. Yes. Okay. They're screened at least once during the measurement period for food screenings and food interventions if they receive, Meals on Wheels or food pantry or something. And then housing screenings to see if they're housing instability, homelessness, or housing inadequacy. And one of those housing inadequacy is cleanliness. It's one of the questions on the Signify home health ones. There's also transportation screenings and interventions for people, especially in the rural areas who don't have access to healthcare. What are they going to do? Walk 40 miles? Okay, so they developed this measure as part of an organization-wide effort to advance healthcare equity and encourage health plans to assess and address food, housing, and transportation needs in their patient populations. Of course, you can't address it if they don't know who the people are who need help, which is where I come in. So, yeah. Okay. ORYX. It's funny because I don't know for sure that this is the exact acronym that it stands for. I looked, the book didn't say it, the JECO's website didn't say it, Joint Commissions didn't. This is what Google told me that it was. And it's a medical acronym site, so I wouldn't swear to it, but it kind of makes sense that, I mean, it stands to reason. It's a logical outcomes research yields excellence. And so that's why I did the EX, excellence. All right, so because it was driving me bananas, I was like, what does ORYX stand for? What is it? What does it stand for? What? So the goal was to promote a comprehensive, continuous, data-driven accreditation process for healthcare facilities to improve the safety and quality of healthcare. I think we missed this first one. Yes. Oh, just kidding. Okay. The textbook says it was initiated in 1997. I was stationed at an Air Force base in San Antonio. It was one of the Department of Defense facilities. We were one of the 5 largest at the time that were selected to endure, to take on process suckers of the project. One of the original rules, as I recall, was that the facilities couldn't have greater than 10 years hard copies of records, including x-rays. Now, the hospital dated back to the 1950s with the same colonels and generals then, now retired, who wanted their records available when they came in for their checkups. They were at cross purposes, and who was in the middle? We had to destroy years worth of x-rays, and they're not the sort of things you could just throw in the shredder. They're heavy and they're radioactive, and they're filled with little bits of silver, and you'd be surprised how heavy they are. Like a stack that's not as thick as this book, probably 150, 200 pounds. Not fun. Since 2016, it has included both chart abstracted and ECQMs, but now they can be entered electronically. So yeah, so you know about the goal. The research, the evidence-based care processes, the proximity. The processes occur one after the one that's measured or before the income or before the improved outcome occurs, so the proximity of time. The accuracy, meaning the measure can indicate if the process was delivered with sufficient effectiveness. And the adverse effect, implementing the measure is unlikely to incur unintended adverse consequences. For example, the benzodiazepine with someone who, I don't know, maybe was allergic to it, or I don't know. Anyway, or maybe for whatever the alternative medication to the benzodiazepine would be counterintuitive, like if they were allergic to it, or had maybe even, they call it, dependence issues with it, and they're like, it's better than codeine, so all right. Now this is an example of the ORYX forms, the EQMs and that sort of thing. Now they split it among the hospital size and how many visits that they have. They use the minimum necessary needed to provide an accurate and reliable measure. And the Medicare and CMS, they both have similar measures, and they make sure that they aligned identical, and they even put it together on one document, the specification manual for national hospital inpatient quality measures. So there aren't two, to ease the administrative burden. Oh, wait. And then you see the facility type for psychiatric hospitals is separate. And then to sum it up, quality measures, they're evidence-based management. We use it for the benchmarking. Performance benchmarking involves gathering and comparing, comparing qualitative data They're usually the first step an organization take to identify performance gaps. Practice benchmarking involves gathering and comparing qualitative information about how an activity is conducted through people, processes, and technology. Internal benchmarking compares metrics. What just happened? Is that it? Okay. Um, stop. Okay. The show must go on. Okay. Internal benchmarking compares metrics and or practices from different units or departments. What you need is at least two areas who have the shared metrics, and what you get is internal benchmarking. It's a good starting point to understand the current standard of business performance. And external benchmarking compares the metrics and practices of one organization to one or many others. What you need, of course, is to have one or more organizations to participate. And what you get is an objective understanding of your organization's current state, which allows you to set baseline goals for your improvement. And that's, in a nutshell, what this was all about, is apples to apples, to have the data necessary for patients and consumers, stakeholders, to have choice. So thank you for your time. I've really enjoyed this class this semester, and I hope you have a wonderful evening.